Hi, thank you all for sticking around late into the afternoon. So I'm here to talk specifically about the Department of Agriculture's nutrition assistance programs that serve older Americans. And I should say, in all of our programs, we defined older Americans or elderly or seniors as age 60 and older. So first I'll talk about two programs that are just for seniors, and I know these have been touched upon in earlier presentations. The Commodity Supplemental Food Program provides low-income seniors with a food package each month that contains foods that are often good sources of the nutrients that are missing from seniors' diets. It's not a nationwide program. It only operates in 46 states, and in most of those states, it's not statewide. So it's pretty limited funding. The demand greatly exceeds our funding. It's about $200 million a year. But even so, almost 600,000 individuals participated in last fiscal year. And this program used to also be available for mothers with young children, the WIC population, but the vast majority of participants were elderly, and then the 2014 Farm Bill made it exclusively a program for elderly. Next is the Senior Farmers Market Nutrition Program. This provides low-income seniors with a coupon that can be exchanged for eligible foods at farmers markets, and the value of the coupon, it ranges from $20 to $50. Again, it's not a nationwide program. It only operates in 43 states. It's actually a tiny program. It's only $20 million worth of funding, but almost 800,000 individuals did receive one of these coupons last year. There are some other programs that serve seniors in addition to other populations. The Child and Adult Care Food Program reimburses centers that provide day services, including meals, to seniors or disabled adults. This is nationwide. It operates in all states and the District of Columbia. And last year it served about 120,000 adults, but that figure is not just seniors. That would also include disabled adults. Then we have the Food Distribution Program on Indian reservations. So this is an alternative to SNAP. Households, Native American households that live on reservations or near reservations can choose to participate in FIDPER as opposed to SNAP, but statutorily you cannot participate in both. This program is operated by Indian tribal organizations as well as states. I should say it's a package of commodities that you can receive every month instead of a SNAP benefit. It's a very small program. It served only about 85,000 individuals last year. And then, of course, there is SNAP, which is the largest program, and it serves people of all ages. It's a mandatory entitlement, so it can grow as the demand or need for the program grows. Last year it was about $70 billion in benefits. The program serves just under 5 million seniors, and that amounts to just under 10% of the overall caseload are seniors. And they receive 7.5% of the benefits, so that means that their benefits are slightly smaller on average than your typical household or your typical participant, and that has to do with the fact they have higher income, which I'll go into in a moment. And almost 20% or 17.4% of households, SNAP households, contained a member that was age 60 or older. And Laura touched upon this in her presentation, but every year we estimate the SNAP participation rate. So we use census data to try to estimate how many people we think are eligible for the program, and then we know from our program data how many are actually receiving benefits. And we've measured this, for the past 30 years or more. And so I have a line there showing the top line is the overall SNAP participation rate, which reached its highest recorded level of 85% in fiscal year 2013. And at the same time, the senior participation rate was only 41%. And you can see that that trend has continued over the past 20 years, that the participation rate among eligible seniors is about half or less than what it is among all eligible individuals. And SNAP participation rates do vary a lot by state. This data is actually 1 year older, from 2012, when the national participation rate among seniors was 42%. You can see that some states in New England, Florida, Washington, and Oregon have participation rates that are higher than the national at 50% or more. And then there's some states like California and a lot of mountain plains and Midwest states where their participation rate among seniors is pretty low. It's less than 20%. So what do we know about the seniors that are participating in SNAP? We know that 3/4 of them live alone, so they're one-person households. Nearly 2/3 of them are women. Their average gross income is 86% of the poverty line, which translates to $883 per month. And as I said, even though that's very low income, that's higher than you would see in your average SNAP household. So across all SNAP households, the average income is 59% of the poverty line. Because SNAP benefits depend on your income, the average monthly benefit for an elderly person is about $106 per person. I think Laura quoted a per household rate that was a little higher, but the average SNAP benefit across all SNAP participants is $131. So because seniors have a higher income, they do receive a lower SNAP benefit. We know that almost 7% of senior households have earned income. We wouldn't necessarily expect a large proportion of people over the age of 60 to be working, but nearly 70% receive Social Security, which indicates they were part of the workforce at some point in their past, and then almost over a third of them receive supplemental security income. Well, what about the 60% of eligible seniors that are not participating in SNAP? What do we know about them? Generally, if we look at their demographic and economic characteristics, it's pretty similar to what we see from those that are participating. They tend to live alone, they tend to receive Social Security, but I think the one big difference is they tend to be eligible for a lower benefit. And this is a bit dated, this analysis. It's using the 2005 SIP panel, but we found that almost 70% of eligible seniors were eligible for a benefit that was less than half of the maximum allotment for their household size. And compared to all SNAP eligibles, that rate is 37%. So you can see that their benefits are skewed towards the lower end. And what we see at the lower benefit levels, which is where most seniors fall, their participation rate is pretty close to the overall participation rate for all SNAP eligibles. It's at the higher end, folks that are eligible for, 75% of the maximum allotment, up to the maximum allotment, that the disparity is much greater. And so what that means is there's some seniors out there that are eligible for a pretty large SNAP benefit that are still not participating in the program. And what do we know about why they're not participating? It's a little bit what Laura touched on. This research is dated, but it's still what we hear anecdotally, and in some more recent pilot projects that I'll talk about in a moment, this is still what we hear during focus groups or interviews, that compared to other non-participants, seniors are less likely to know whether or not they'll be eligible and how much of a monthly benefit they would get. They don't know where or how to apply for benefits. And in general, they just seem to be less interested in the program, even if they think they might be eligible. And some of the reasons that they've cited are that they just want to be independent. They think there's a cost to applying and participating. They think their benefits are going to be low. Or they just think there's a stigma associated with accepting government benefits. And maybe they're not all aware that now it's an EBT card, it's not the paper coupon, so it's less obvious in the grocery store who is a SNAP participant. Now I'm going to talk about some pilots that we've done in the past 15 years or so in an attempt to increase participation among elderly individuals. In 2002 to 2004, we operated pilots in 6 states that tested 3 different approaches to try to increase participation among seniors. In Florida, the pilot consisted of simpler eligibility determination rules. So this meant it required less documentation or verification of income and expenses, and it waived the eligibility interview. And we had pretty good results that it increased participation among this group by more than 20%, and it was also a very low-cost pilot to operate. We just changed the rules. There weren't a whole lot of costs associated with it. Now, I should point out, during this time frame, 2002 to 2004, the SNAP participation rate, or the elderly participation rate, was in the mid-20s. So when you talk about a 20% increase, we might be going from 25% to 30%. Then in Maine, Michigan, and Arizona, we tried one-on-one application assistance. So this meant that, you were sort of helping them fill out the application, get all their verification and documentation together. And in this site, we also waived the eligibility interview. And I think we had mixed results, but in the most successful site, it did increase participation by more than 30%. And it was a little more costly to operate. And then finally, in Connecticut and North Carolina, we tried offering a commodity package each month instead of a SNAP benefit. And in one site, it really didn't work out at all. But in the other site, it did increase participation by more than 35%. But it was very, very costly and difficult to implement when you think about transporting the food, storing it, and setting up a distribution site. In a lot of states, seniors could get the commodity supplemental food program if they preferred that option. Then in 2009, we ran pilots in 3 states that, again, tried different approaches to facilitating access for seniors. In Michigan and Pennsylvania, they provided application assistance. They also developed a simplified application that, again, waived those income verification requirements. And it didn't waive the eligibility interview, but it could be conducted by a CBO or community-based organization rather than having to go to a SNAP office or do it over the phone. And then in Ohio, they only provided application assistance, so it's a much simpler project. What we found is that Michigan and Pennsylvania did have statistically significant impacts on senior participation, so it seems like the more hand-holding application assistance, a simplified process, was really what was most helpful. And interesting, we did find that among the oldest seniors, so those are people age 70 and older, that this effect was even stronger. And so it may be that not having to go to a SNAP office, you know, for the interview or to submit your application was really helpful. And then finally, in 2009, we looked in 3 different states at ways of reaching out to individuals who were either recipients of or in the process of applying for Medicare's Extra Help program, which helps seniors pay their Medicare Part D premium, which covers prescription drugs, or the Medicare Saving Program, which helps seniors pay for their Medicare premiums. So in Mexico, they had a combined application for both the Medicaid program and SNAP. They deemed income, once you'd been approved for the Medicare program, we could just take the income from that as having been verified. And they offered a standardized benefit, so you didn't have to provide all of your expenses to sort of calculate what your actual benefit would be. In Pennsylvania, it was a shortened application. They provided one-on-one application assistance, and they deemed your income if you were already receiving Medicare. And then in Washington, they had a shorter application, and they sort of did targeted outreach to those seniors that were already in these programs but weren't yet on SNAP. All 3 pilots had statistically significant effects on participation, but they were very, very small. So we weren't quite as thrilled with these pilots as we might have been. We were hoping to see a bigger increase. You know, it was statistically significant, but it didn't seem to have that much of an effect. And what we found during these pilots is that there were some eligible seniors out there that we reached out to, and they still chose not to participate. But in general, we think that they probably had better levels of food security and didn't feel that they needed SNAP benefits. So some other things that we do to encourage participation among seniors: combined application projects allows households where everyone is either receiving SSI, either as an elderly or disabled recipient, that they can receive SNAP benefits automatically, that we use a standardized or a simplified benefit, and it sort of eliminates the need for visiting the office and going through the interview. They're just automatically eligible for SNAP, and caps run in 18 states. Laura talked about the standard medical deductions, which reduces the amount of verification that senior households need to provide in order to receive the standard medical deduction. If they can show they have expenses that exceed $35, they're eligible for the much higher deduction, which in most states is more than double that amount. So it makes their SNAP benefit larger. Again, 18 states are doing that. And then finally, 7 states have an elderly simplified application project. So this uses a much shorter application. They do data matching to fill in the income and expenses as much as they can. And then it allows for a 36-month certification period. So once you're on SNAP, you're good for 3 years. Now, this is only available to households where there's no earned income, but as I showed earlier, less than 7% of elderly households have earnings. So a couple of current initiatives. This has also been mentioned that the 2014 Farm Bill now allows home delivery services to accept SNAP benefits for homebound senior or disabled participants. We published the proposed rule in July, and then hopefully in early 2016 we will issue a request for volunteers to seek meal delivery services that are interested in accepting SNAP benefits. The Farm Bill did say that until we've actually published the final rule, we're going to be limited to authorizing no more than 20 services. And then also in our FY16 budget request, we asked to expand elderly simplified application projects, which would just make it easier for states to take up and be less reporting requirements for the states. So we're hopeful that when we get our FY16 appropriation, we will be able to do that. And then just in conclusion, there seems to be some things that show promise in getting more seniors to come to SNAP. One-on-one application assistance, using a simplified application that reduces the verification requirements, waiving the face-to-face interview in the SNAP office. These have all shown to be effective, yet there's just still some barriers that we don't know how to overcome. It seems that some eligible seniors may never choose to participate, And so it's unlikely that FNS will ever have a participation rate among seniors that's equal to the participation rate among all eligible individuals. So we're going to continue to rely on a range of programs to meet their needs. Thank you.